Hello, everyone. I am Jeannine Blake. I'm a PhD candidate at the University of Massachusetts Amherst, Elaine Marieb College of Nursing. And I'm also affiliated with the Institute of Applied Life Sciences there at UMass Amherst and the Marieb Center for Nursing and Engineering Innovation. I am trained as an intensive care nurse. I love critical thinking. I love learning. And I'm really excited because next year I'm going to begin a postdoctoral fellowship in the College of Engineering, also at UMass Amherst, where I just have so much support for my research and my passions. So I thank you for having me today. I'm excited to talk to you all. I practiced as a surgical intensive care nurse in a high acuity level 1 trauma center. I really enjoyed the work. I really liked troubleshooting and everything that's involved in intensive care. My mind was always active, and I loved caring for patients and their families. When I decided to return to school, it was when I started to miss formal education. If you look at my resume, I've done a number of degrees and always seem to go back to academia. And so that's where my career is headed as well. And I'm not surprised by that. So when I decided to return to school, I missed that formal education. I continued to practice as a critical care nurse. I still loved the critical thinking aspect and the patient care. But going back to school was right for me. So I also, during that time and during that transition, started to feel like I could have a broader impact on patient outcomes by continuing my own education and furthering my role in healthcare and in whatever capacity it would turn into, which has gone on to give me a career in research, in nursing research. And I feel really passionate about what I'm doing. It's very much informed by my nursing background. And I really think that I can make a big difference for patient outcomes and nursing workflow through the research that I'm now pursuing. That's a great question. Honestly, I don't think I realized I was in such a collaborative space until I was already embedded in it. I'm actually interdisciplinary myself. Like I said, I have past degrees. I was trained in biology and chemistry initially, and my program of research now focuses on the safety of large volume intravenous smart pumps that are used to deliver medications in acute care medicine. And so from a broader perspective, I'm really focused on solving clinical problems through improved product and device design using interdisciplinary approaches. So my research on IV smart pumps and their safety and efficacy and usability is just an example of how the nurse engineer and clinician engineer and other collaborative disciplines, how those partnerships can help to improve existing technology and innovate for easier and safer use going forward. I'm very fortunate to be at UMass Amherst, where there's really an amazing set of resources for collaborative research and innovation. The Marieb Center for Nursing and Engineering Innovation has been designed specifically to foster this type of collaboration. And I just feel so fortunate to work there and to learn from the faculty there. I've been able to work with some incredible collaborators across disciplines and have mentors in both nursing, engineering, and other disciplines outside of the university. And this really fosters a lot of interdisciplinary collaboration and work. I'm really excited about where my career is taking me. It's so important for us to encourage nurses to get into collaborative spaces. I truly believe that the tools we provide clinicians, in terms of products and devices, will be dramatically improved by involving more nurses in their design. So end user nurses are poised to not only help identify the problems that need to be addressed in the clinical space that these products and devices are designed to be used, but nurses are also the best people to inform the solutions so that design processes can be smoother, that results of that design is more usable, and the outcome is a safer product. Nurses can be involved in any level that they want. I talk to a lot of nurses and a lot of nursing students who say, well, I still want to practice. And I say, that's great. But they say they also want to have a bigger impact, and they want to be involved in innovation and collaborative work. How do they do that while also practicing? And I think that on whatever level a nurse wants to be involved, there's opportunity. There's a lot of opportunity for nurses in this space. And personally, now I am a full-time researcher, I'm not at the bedside anymore. Although my clinical experience really informs the work that I do, I really value the input of clinicians, nurses especially, in my work. If my work isn't informed by clinical practice, then it's not going to be as beneficial and as impactful as it potentially could be. So I'm always looking for nurses to work with, to bounce ideas off of, to have their input on what we're working on. I think that's really important. And so I really place a tremendous value on the perspectives of clinicians who are working on the front lines and seeing the issues that arise every day. You're always troubleshooting. And I need nurses and frontline clinicians to help make my work meaningful. And I hope every other researcher sees that also. So if you're a nurse looking to get into research, there are so many opportunities. How involved you still want to be with clinical practice, those opportunities don't close. So, feel empowered. I hope you feel empowered. Definitely, work towards whatever capacity you want to be involved. You'll be able to do it. My nursing experience has been really pivotal by informing my research. Like I said, my clinical experience at the bedside gives me a huge amount of understanding of what it's like to work at the bedside and as a clinical nurse. And so my research on IV smart pumps, I used IV smart pumps every day and every shift in my clinical practice. And so I have a lot of conversations with my engineering colleagues and other folks, doing this research who don't have that clinical experience. And it's phenomenal. Sometimes I surprise myself that I'm able to provide the input that I can. Meaning, there's a lot of times we have a conversation where I ask a question that's clinically relevant. My question is because I experienced this at the bedside at one point or another. And there have been a number of times where somebody tells me, well, that's not really how it was designed. I say, oh, well, that's how it's used. So, I understand that it may not be designed to do that, or it's not meant to X, Y, or Z, whatever it is that we're talking about. But the clinical relevance is the important part. These devices are designed to be used in the clinical setting. So the experience that I had from being a bedside nurse, from working with the tools that I am now studying and that I am now trying to improve, has been so important for my impact on those devices. And in terms of working with engineers and research, I think that in part my background in biology and chemistry, I was initially trained as a bench scientist. I think that perspective helps me, but I also don't think that it's not what defines me as a researcher. I think that ultimately my clinical experience and my nursing experience is what what gives me the most impact and the most value in this space. Advice for other nurses wanting to get into research or wanting to innovate, wanting to work with engineers or other disciplines. I think first and foremost, I want to say stay curious. When I talk to future nurses, when I talk to current nurses, it's easy to accept the status quo. It's really easy to say, well, this is, X, Y, or Z doesn't work well. I do the best I can, and that's just the way it is. And I want you to challenge that. I want you to say, no, it can be better. I found myself in that position of being frustrated every day with something. And it wasn't until I started my graduate program where somebody said, it doesn't have to be that way. You have a voice, you have a spot at the table, speak up, that I started finding my voice. And so feel empowered. I think that one of the best things that you can do is find a mentor, find somebody who will encourage and support you and advocate for you. I've been very lucky in this area. I'm also a big believer of paying it forward. So I am always happy to talk to nurses who want to talk about challenging what is currently happening. And if you want to pursue research, if you want to get more involved, to whatever capacity a nurse wants to talk about this stuff, I am always here. So I really encourage everybody to, like I said, stay curious, continue to question, don't accept the status quo as the way it has to be, and talk to people. Find a mentor, find somebody who's going to support you and encourage you. I've been very lucky. I have a mentor, Dr. Karen Giuliano, who is my PhD advisor, and she's become a lot more than that. She's truly a mentor. I never question whether she has my back and whether she will challenge me. She will always advocate for me. And I think that I met her right at the beginning of my PhD program. She saw something in me that I hadn't seen in myself yet, and she continues to help bring that out of me. And I'm just so appreciative. She's also a rock star nurse. So she's a critical care nurse who went into industry. She worked for some of the big product device manufacturers for about 20 years. So she comes into, the research space that I'm now in with a very different set of talents and experiences than anybody else, whether, myself included, because I don't have that experience working in industry for the companies that actually make these products. And so she's got just valuable experience. And like I said, just her advocacy and empowerment is just phenomenal. I'm also really inspired by my friend, Lindsay Roddy, who is an ICU nurse turn nurse entrepreneur. So she is the CEO of Roddy Medical, and they have designed and are now distributing to hospitals this really innovative and incredible device to help tube management for acutely ill patients who would benefit from improved mobility. And she's a great example of a nurse who saw a problem in her clinical practice, said, this isn't okay, something needs to change, and she went for it. And I really admire her. And then I have a number of other mentors and collaborators. My future postdoc mentor is Dr. Juan Jimenez. He's a fluid dynamics engineer at UMass Amherst. And he's been really, he's really a mentor at this point. I haven't known him for as long as I've known everybody else, but but from a different direction. You know, he's trained as an engineer with a big background in medical science, but we come at similar problems with different perspectives. And it's been really empowering for me to be shown the kind of respect that he shows me as a nurse, because we all know that there have been a lot of environments as nurses where we may not feel that way. And so he shows me the respect that I think every nurse should experience when working with a collaborator. So I have so many more. I've been, like I said, I've been very fortunate, but these are the highlights of my role models and my influencers at this point. I just want to leave everybody with a couple of key points, right? As a nurse, as a practicing nurse, I cannot say it enough, stay curious, challenge what doesn't work, don't accept it as just the way it's going to be, and talk to people. Take that curiosity and talk to other people. Anybody here is welcome to contact me, but I know that there are so many other people out there in similar positions to my own who would be happy to encourage and brainstorm with a curious nurse or clinician. So those are my ending thoughts, and I'm excited to see what's to come.